we're back. With us today is Dr. Latashia Hicks. She's a family physician for over 10 years, now specializing in optimizing hormones for both men and women. Thank you so much for joining me today.
Well, thank you for having me. I'm so glad to be here.
So am I. And we've spent some time talking about hormones in so many different ways. I'm really excited for us to have this conversation. So one thing I'd love to start with right out of the gate, I know you're working with people in relationships, so both parts, husbands and wives, or just men and women in relationship together, and you have something called you look at men that are grumpy men and irritable wives, or could you tell us a little bit about that?
So actually I call it the grumpy old man syndrome and irritable wife syndrome, something that I came up with. But when your hormones get low and things start to kind of decline over time as we age, a lot of times people don't realize that it actually affects their mood, it affects how they feel, it affects their vitality. And so this spills over a lot of times into relationships. So this has been something that I've been so passionate about because I love seeing couples just get their mojo back.
I love Get Your Mojo Back. That's wonderful.
Yes.
So where do you start with them when they come in? Or it's probably one. They don't usually come in as a couple at first. Is that right?
Well, sometimes it all depends. So sometimes I actually do have couples that come in together, and sometimes it'll be the wife first or be the husband first.
Okay.
So it's been interesting because I actually had one of the most interesting ones was the husband actually said, listen, I need my wife to come see you because she's feeling bad, she's feeling down, her mood has been low, she's grumpy, she's snapping at me, and we're having a hard time. And I think she needs her hormones optimized. And so he sent her to me. So sometimes it can be the man or the wife.
Had you already worked with him on optimizing his hormones at that point?
No, actually, I met him at an event where I was speaking about hormone therapy and the benefits of hormone therapy. And after he found out that I did that and more about it, he was like, I think this is exactly what my partner needs.
That's great. So when you speak or when you're in this presentation, even in the office with men and women, what are some of the symptoms that these men and women are experiencing where they could at home, our home viewers would be able to say to themselves, wow, that might actually be me if I'm feeling that way, and then they would know to come see you. What would those symptoms look like?
Well, there's a lot of different symptoms. So this is what I want you to look for. If you are feeling sometimes irritable, snappy, you feel like that little things make you feel angry or make you feel irritated with your partner or irritated with other people, you feel like you don't really have a lot of reserve for or a lot of tolerance for nonsense, as people would say. Also, I would say if you're feeling a little bit sad or depressed, and in men, sometimes depression or sadness can exhibit itself more as an anger or angry response when really they may be feeling a little bit down. Also, it can affect your libido. It can affect the way that you all interact because this strain that it puts on the relationship can cause you to feel not connected with your partner. And so all of these things start to kind of trickle down.
Okay, so lower libido, so if your sex drive is less, if it has declined in some way, I think frequently people think, well, I'm just tired or I'm working too much, which can very much be the case as well. But that may actually be a symptom of their hormones being dysregulated and not being in an optimal state.
That is so true. So most of the time, the one thing that people complain of more than anything is the fatigue.
Okay.
I feel tired. It's hard for me to get out of bed in the morning. I feel like I'm dragging. I feel like I'm having a hard time. That is the most frequent complaint that I get. And so that kind of trickles over because if you're already feeling tired, it's hard for you to get out of bed. You definitely don't have a lot of energy for dealing with other stressors, trying to deal with relationship stressors. And a lot of times, unfortunately, it does trickle over into couples' intimate life.
That makes perfect sense. And I think people don't realize then that there's something that they can do about it, and it might actually be a visit to see their doctor to be able to check those hormone levels.
Yes.
So and that's what you do. You do some hormone level checking.
Yes. So I do extensive labs for my patients, not just the hormones, but I also am checking you overall because I'm looking for every other cause of fatigue as well. So when I do my blood work, I'm checking a complete blood count. That's checking for anemia, platelet dysfunction, white blood cells, which can show that there's an underlying infection. I'm checking a comprehensive metabolic panel. That's checking kidney function, liver function, electrolytes, things that can show whether you may be dehydrated, that may be underlying. Then I'm going to also check your thyroid levels. So most of the time when you go to the doctor will only check a TSH level.
For thyroid, so this is a thyroid.
For thyroid, they'll check a TSH level and maybe a T4 or maybe a T3. But when I do it, I check a T4, a free T3, free T4, thyroid peroxidase antibodies, which is also known as TPO antibodies. I check all of that to see if there's any underlying inflammation in the thyroid. And then I also check your B12 levels to see if that could be a cause of energy, as well as testosterone, estrogen levels. And so it's kind of a comprehensive thing, cholesterol, checking for diabetes, everything else that can be causing other issues underlying.
Getting that whole picture,
yes.
Taking a look at absolutely everything.
Yes.
And they can also be very interrelated as well.
That's right. A lot of people do not realize that the cholesterol is highly associated with hormone deficiency because cholesterol is one of the building blocks of the hormones. So if your body is imagine it as a conveyor belt or like an assembly line.
Okay.
And this assembly line is trying to make testosterone. And your body is not making enough testosterone, whether that be women or men, because sometimes a lot of people don't realize that the hormone deficiency that causes the most problems for men and women is testosterone, not estrogen like most people think for women. So you're trying to make this testosterone, but it's backing up because it's not making enough, and now the cholesterol starts to look high. A lot of times I fix people's cholesterol by optimizing their hormones.
Oh, that's fascinating. So if you open up the production line to be able to make the hormones that you need, because cholesterol is that precursor molecule to make them, but if you don't have the appropriate components to be able to build those hormones, then that cholesterol might actually elevate.
It might actually elevate.
So when you open up this dam over here and let things flow through, then that might correct, that might auto-correct some of that, some of your cholesterol issues.
And I actually have a patient who this happened to. He has a history of heart disease and had a stent placed years ago. And after having his hormones optimized for over a year, lost over 30, 40 pounds, doing exceptionally well, had a knee surgery and was able to recover well. The physical therapist couldn't even figure out why he recovered so well and so quickly. It was because he was just, he had the energy, his body was healing, he was feeling his vitality. And so he recently went to the cardiologist for a checkup and for another heart cath to check on his heart vessels to make sure that are they having any blockages, is it looking better or looking worse. And actually he said that the cardiologist gave him a clean bill of health. His arteries looked amazing. No big blockages there, nothing that required any intervention, and he's doing so well, and the cardiologist could not believe how well he's turned around. And so he really equates a lot of his success to the lifestyle modifications that he did as a result of us discussing what needed to be done. It's not just the hormone optimization, but you have to do your part as well, with eating right, with doing all of the things, exercising, and he did everything that he was supposed to do, everything that I instructed him to do, and he is doing amazingly well.
I'm so glad to hear that too, that you add in that lifestyle part, the nutrition, the move your body. So if you're feeling fatigued and it is related to a hormonal imbalance, you can help give them a boost in that space to be able to help reverse that fatigue, to give them the energy to be able to do the lifestyle optimization, and then it just compounds upon itself.
Yes.
That's really great. So how does this wrap up around to when we have our grumpy old men and irritable
syndrome?
Yeah,
so irritable wife syndrome.
And irritable wife syndrome. So I imagine, well, we know when our partner is doing so well, it always helps us do better as well, because we want that for each other. And so tell me a little bit about how that works for your couples when they come in.
Are you saying about the exercising?
Oh no, just the irritable old men.
Oh,
like what's
yes.
or whatever. No, sorry, the grumpy men, irritable women.
Yes.
How does this transition transpire for them?
So what typically happens is after you get your labs done, I will then discuss with you options for how you can optimize your hormones. I have several different options. So the best option is bioidentical hormone pellet therapy, which technically is a little tiny pellet, and there are multiple pellets depending on your body, your weight, your lab work. I will determine the proper dosage for you. So each one of these therapies is individualized to the person, which is what I love about it. What works for this person may not work for the next person. So everything is optimized. And then as we get the pellets going, I may have to make adjustments to it and things like that. So until the person has the perfect fit. So that's how it really works. But usually when I put the pellets in, it's a little short procedure, takes less than 10 to 20 minutes. And people usually typically start feeling better within days.
That's incredible. Well, thank you so much for being with us today, Dr.
Yes.
Hicks. Will you please let everybody know how they can find you?
Oh, yes, please. You can find me on Instagram at xcareelite. That's EXCAREELITE. Also, you can call the office 713-659-9309 or find us on the web at www.exceptionalcareelite.com.
Thank you so much once again, and I hope you'll join us next week.
Yes,
Wonderful.
I would love to.
Wonderful. Well, and thank you for joining us as well, and please stay tuned after these messages for our next guest.